Good evening, everyone, and welcome to Charla. Tonight's talk is on mental health and lupus. I am excited to welcome Dr. Kevin Yip, who is the Chief of the Rheumatology Division and Associate Program Director of Internal Medicine at Wyckoff Heights Medical Center. He studied at University College London Medical School, graduating with top honors before completing one of the most competitive residency programs in London, UK. Thereafter, he pursued further training at NYU's main campus for medicine, residency, and finished rheumatology fellowship at the Hospital for Special Surgery and NYP Cornell. His prior published research has focused mainly on gout and SLE. Dr. Yip is also an active member of OMRAC, organization which sets the gold standards for rheumatological research worldwide. Dr. Yip is passionate about improving the lives of his patients and changing how we view illness and health. Let's give Dr. Yip a warm Charla welcome.
Oh, okay. I don't know. All right, bear with me. Okay. Good evening, everyone, and thank you so much for being here. I know it's really, really hot outside, but this is a topic which is very near and dear to my own heart and also to so many of everyone in the room. I think everyone should be talking about mental health, and it's a real shame that it's really not talked about enough. Now, hopefully we're going to cover quite a few things today, but I also want to make sure that if there are any other topics that we've not covered, we are all welcoming any sort of questions or any other suggestions for anything on your mind, really. So I don't need to tell you guys that lupus mostly affects women, and it's a real cruelty that it affects those who are often in their reproductive ages and also those who are ethnic minorities, as if there weren't enough challenges for this cohort of people already. There are so many implicit biases, so many unseen prejudices for all people, really, but especially those that are affected by lupus. So I want to sort of talk through a little story. And I want to picture the sort of average lupus patient that I see every single day. Anna is a 22-year-old in her last year of college, and she's hoping that when she graduates, she's going to be a professional photographer. She has a part-time job, because doesn't everyone these days, and she works as a Uber Eats driver to make ends meet. She has one younger sister, her parents are divorced, and she lives at home with mum. So Anna was diagnosed 3 years ago in 2021. And unfortunately, she was the first person in her family to have had it. A story which is very similar to a lot of our patients is that she had first a rash, some swollen fingers, and she notices changes in her skin and her hair. She's been treated with a medication called Plaquenil, Benlysta, which is a type of infusion therapy, and prednisone, which is a kind of steroid. So I want everyone to think back to their own experiences in the room. How does your condition affect you physically? And I want to bring you back to when you were first diagnosed. And what would you say to yourself back then about how your body would change? There are so many physical manifestations that you probably didn't realize could happen because of lupus. So, unfortunately, many people suffer from some of these symptoms, sometimes all of these symptoms. But just a few ways are things like chronic pain. Sometimes it could be arthritis itself. Immobility, difficulty getting to places, and tiredness. You know, no one talks about the tiredness. It's overwhelming. Lupus fog. So sometimes people will complain that their memory isn't as good as it used to be, or their concentration isn't quite right, or even their mood goes up and down. Pregnancy and intimacy are also two big topics that no one talks about. In a 22-year-old female, what's on her mind? Does she want to start a family? What about her boyfriend? So if I related it back to Anna, these are some of the ways that her symptoms affect her. So with that pain, everything hurts, debilitating at times. When she gets those swollen joints, she can't actually cycle to do her work. She can't even cycle to go to college. And that makes it very hard to get to her lectures, makes it very hard to do her deliveries, makes it very hard to even see her friends and do her hobbies. You can imagine that having a full-time studying and also a part-time job is already exhausting for anyone. And now you add lupus into the mix. The lupus fog I mentioned makes it difficult for her to study and concentrate for long periods of time. In terms of pregnancy, she had always dreamed of having a family, had wanted at least 2 kids in the future. And then with her intimacy and her sex life, she just got a new boyfriend. And now she's kind of worried about how this is going to impact them and their relationship together. So how many times have you heard this? We're just seeing a doctor, what's the big deal, right? Not all disabilities are visible. Often many are not. So what are some of the ways your peers, your friends, your family, or your colleagues, how don't they realize how stressful a condition can be? What do you wish you could tell them? I'm just going to let that simmer for a little bit, because I'm sure that you've probably wanted to tell your boss what you really thought about what's going on, what you wanted to tell your friends of why you couldn't go out. No one talks about the burden of medicine on our patients. This Benlysta infusion that is life-saving for her is once a month. It is about 5 to 6 hours each time. She has to trek all the way out there. She has to take a day off work or a day of college. Thankfully, she's relatively well controlled in terms of her lupus. And even then, she has to see a rheumatologist every 3 to 4 months for just basic things like lab work. Basic things. She sees her primary care doctor every 6 months, like any other person would. And because of her facial rash, she sees a dermatologist as well. And when you think about it, I already count about maybe 20 appointments over a year. And that's just the ones that she has planned. What about the new issues that come up? That's a lot to ask of anyone. So I just want to highlight some of these explicitly. Healthcare specific, you got to take that time off work. You got to take that time off your job, your responsibilities. Maybe you look after a family member. Maybe you're looking after a child. Taking that time off work is a luxury. And it's a luxury that few can afford, either in terms of time or financial need. Then you have to travel to your doctor. How many of you live next door to them? Probably no one. And then no one talks about how bad these tests are. Every pinprick or fasting blood test or urine tests. And then you got to wait a couple of weeks for that result. Is it going to be okay? What's my doctor going to say? That is very anxiety inducing for anyone. So these are some of the ways it affects Anna. It's hard to keep up with a normal life. It's hard to see her friends and family. So what are some of the things which are a bit more disease or treatment specific? Everyone talks about how immunocompromised our patients are and how dangerous some of these medicines can be. So naturally, she's scared out of her mind. She starts obsessively washing her hands. She's wearing her masks. She's too afraid to go outside. And then there's the checkup itself. It's invasive, right? They're asking very personal questions. Can you trust them? Do they even know what they're doing? Is this even a good clinician? Do they know what's best for me? And then there's the fear of the meds itself. I've had so many patients who have sadly stopped taking their meds because they've been so worried about them. And it's very understandable. So, how does your condition affect your lifestyle? If I bring you back to when you were first diagnosed, what would you say to yourself back then about how your life would change? If anyone would like to share their experience, we would love to hear it. And it's very okay if no one is, okay?
One of the members shared felt like as a group, all the things that she thought she would accomplish and had to kind of reimagine what life now.
Thank you. It's a form of grief. You're mourning for your previous self. You're mourning for a future self that you didn't know needed to exist. So this is how it starts to affect Anna bit by bit. Her grades start dropping. She used to be a straight A student. Her job, well, she can't really cycle anymore. So it's taken a hit to her savings, and now she's behind on tuition. She can't rely on her family for help. They're already a single parent household, and times are hard. You got to worry about things like insurance. And then a thing that people don't think about is how does that impact things like disability insurance, medical insurance, life insurance, home insurance? Those premiums don't go down because you've got a chronic illness. And then in terms of her hobbies, what she used to do was play basketball with her friends. And she finds that very difficult to do these days and becomes more and more isolated. So how does your condition affect you? How does it change how you think about yourself? How does it change how you feel about yourself? Do you love yourself in the same way that you used to before? Those are probably some very hard questions that have probably crossed a lot of your minds at some point. So for Anna, a lot of it is her self-image. She's worried that her boyfriend finds her unattractive. She's worried by her skin and her hair changes. So she hides her hair. How does it affect her friends and her family? Well, she doesn't join in on family events anymore. She's too tired. She's sick of the questions. Travel, medications, alcohol. She's too scared to explore life. So she doesn't want to go out and do the things that she used to do anymore. So over the last 6 months, Anna has felt increasingly tired and exhausted. She feels bloated and not like herself because of the medications. And she distances herself away from her social support. She's worried about her finances, but she can't do anything about it, and she spirals and is overwhelmed by life. So this is a word cloud that someone had made of people when they think and talk about mental health. What kind of things come to mind? Disease, burden, costs, illness. One thing which we don't talk about enough is implicit bias. And that is something which is, how to explain it would be something like, you see something and your unconscious mind immediately jumps to it already, okay? These are not things that our conscious mind can control. And we have to realize that actually that can be impacted by our culture, by our upbringing, by our surroundings. So hopefully we're going to talk a bit about mental health today. And I really hope that you guys can take a few tidbits from this, hopefully find some peace. So, a few facts. Neuropsychiatric lupus affects up to 9 out of 10 of lupus patients. 9 out of 10. So that can range from anything from feeling sad, depressed, to things like lupus fog. When you add up how many patients have depression and anxiety, it's almost half of them, if not more. The doctor can be a real aid. And I really hope that you guys can reach out to them in your time of need. And there are so many ways that your care team can help. So Charla is a real inspiration to me. And some of the ways that support groups can benefit your mental health can be just by listening, just by holding space, just by having someone recognize some of these difficulties when no one else has. When we've asked patients about mental health, there's a lot of themes. Some of them are from our family and our upbringing. I can tell you that in Chinese culture, they often will tell you to go drink some herbs, do some acupuncture, and maybe that will make it all go away. To not do things like drink cold water, right? They have a hard time understanding that this is a real illness, and those things are not going to cure a real illness. Stigma is another huge one. It's a very vulnerable position to be in, a very personal one. And then we've got our financial geographic barriers. The average waiting time to see a new rheumatologist in America is about 4 months. Can you imagine having a disease for 4 months and not being able to even see someone? It's horrible. You will find that there are some states that actually don't even have a rheumatologist for hundreds of miles. And it's even worse in pediatric rheumatology, especially. So I want to make a bit of a distinction between mental health and mental illness. So what is mental health? Mental health is a state of well-being. It's not just about being happy. It's about being resilient. It's about having the tools to cope with the stresses of everyday life. It's about feeling like you belong, feeling like you're confident, and feeling like you're the self that you want to be. Mental illness is where someone's condition negatively impacts their life, stops them from doing the things they want to do, makes them feel like they're not themselves anymore. So it wouldn't be a rheumatology talk without talking about steroids, okay? And I want to sort of just address it a little bit up front. It can be very beneficial and it can be very harmful if not used correctly. Some of the side effects that you've probably heard about, or maybe even experienced yourself, are things like weight gain, sleep disturbance, right? But we don't often talk about the fact that even steroids themselves can make you really anxious. They can make people feel really down. But I do want to put this disclaimer out there, okay? Because unfortunately, I've seen so many patients who, because of those side effects, have changed their steroids themselves. If it's something that concerns you, I would really encourage you to go talk to your clinicians, okay? And hopefully there's some wiggle room, there's some compromise. But stopping your steroids abruptly, changing your doses by yourself can be incredibly dangerous. And I've seen too many patients be harmed by that to not warn everyone here in this room. So what is depression? Well, depression is not just sadness. It's okay to be sad. It's a part of the normal human spectrum of emotions, as is anxiety. But depression really is more of a state of being that can last longer than just that acute stressor. Sadness can come and go, but depression stays. And depression is insidious, seeks into every part of one's life. It can be very different for everyone. So you might find that you have some of these symptoms, maybe only one of these symptoms, or maybe even all of these symptoms. It can look very different. One thing that I often hear people talk about is they just want to give up. They just don't want to exist anymore, and they just want it all to stop. The word for that is called apathy, and it's a real sign of depression. And I want to make a distinction between that and thoughts of self-harm, which if you find yourself in that situation, I really hope that you can reach some help. So thoughts of death itself, hurting yourself, even those intrusive thoughts, or even making a plan, are really red warning flag signs to go find some assistance. I want to talk a bit about the different types of depression, okay? So a very common one is what we call major depressive disorder. So even if you do the things you like to do, you just don't find them fun anymore. It's a real drain. Whereas some people, you've probably heard of prenatal depression, right? So around the time of pregnancy, it can be really, really hard with all those hormonal changes, all of those new responsibilities and all those stresses. It's probably not easy to bring a child into this world. For some, especially in our lupus patients who are mostly female, I'm probably not best to talk about this, but a period and even your cycle can really affect your mood. There are some people that get what we call seasonal depression, and that is often during around the winter time, around the fall, often coincides to the lack of the sun as well. So depression is common. There will be many people in this room that have depression. There will be many people that you know that have depression that just don't talk about it. And there are many people that you know that are on treatment that don't talk about it. And really, it's up to us to break down that stigma, to really talk openly about how we're feeling. Some of the medications, like steroids, can cause depression in and of itself. And lupus can also affect the brain in many different ways, including that way. I don't want to go too much in detail about this, but this is one of the scales that we use in medicine to kind of gauge how depressed someone is. Obviously, depression is much more than just a simple score, right? But if you look through these 9 questions, and if you find yourself relating to them, that might be a sign. And that might be a sign that you need to go talk to someone about your mood. Anxiety often coexists with depression. And it isn't just about stress. Stress and anxiety are your body's natural defense system. It's trying to make you plan about the worst case scenarios. It's trying to help you and trying to protect you. But anxiety disorder is when it becomes harmful. It's when it actually starts to impact your life in a way that you can't even do your normal things anymore because you're paralyzed by that level of fear. For a lot of people, they don't even realize that they're anxious because they feel it in their body. And that truly is a way for the body to tell you that you are under attack, that you are under this pressure. Commonly, it's things like sweating, feeling tense, shaky, even panic attacks, labored breathing, dizziness, fast heart rates. This is the score that we use for anxiety. Much in the same way, I just want you to look through some of these questions and ask yourself, what would you answer? What do you think your score would be? And if you find yourself answering nearly every day, go talk to someone. So these are some of Anna's anxieties. Will I ever find a partner that supports me? Will it affect my sister as well? Will it affect my ability to have kids? And even if I have a family, will I be giving lupus to them? These medications, will it change how my pregnancy will be? And how does lupus itself affect my fertility? I'm just going to talk briefly about reproductive health and also acknowledge that it also affects men too. There are many of my patients that have lupus that had completely normal pregnancies that have raised an amazing family together. But I have to say, it's often with the close support of their rheumatologist. Those kinds of pregnancies can completely happen, but you just have to be under the careful eyes of the doctors that know what to monitor you for, because this is not just like a normal condition. So Anna decides to open up. She eventually decides to confide in her mother about some of the ways that lupus has affected her and her life. And you know, mum doesn't have lupus, so she can't fully understand, but she can sympathize. And you know, she tries to make some way to talk to her family about maybe let's try and do something which is less energetic. What can we do to help support Anna and bring her back out to us? She reaches out to her school, and her school gives her extra time for studying and accommodations for her exams. She decides to speak to her social worker about her mood. So what kind of help is out there? Well, there's therapy, and it's always something which I suggest to everybody, even if they don't have any mental health issues. I think it's really important that we all have a safe space where we can talk about our problems from day to day, or just need someone to listen. So there are many types of therapy, from psychotherapy to cognitive behavioral therapy. all right? And I will leave it to whoever assesses that patient to decide what's best for them. A therapist is someone to talk to. It's important to know the distinction between a therapist and a psychiatrist as well. And often these two work closely hand in hand. A therapist is a licensed counselor, and they are very well qualified to explore some of those thoughts, feelings, and fears. Whereas a psychiatrist is normally someone with a medical degree, and they more specialize in the kind of treatments that we can give in terms of medicine. It's really quite well established that you really need both of these people hand in hand. Therapy can work just right for some, medicines for some, but they really work better when you combine them. There's a big stigma behind antidepressants, and I really hate it. Sometimes it will take me a good year or two to convince my patients to have it, only for them to turn around to me in a few months' time and say, I really wish I could have started earlier, Dr. Yip. There are many types of medicines out there. Some of them are even better for sleep, some of them for anxiety, some even for things like nerve pains, which I know a lot of my patients have. So talk to them. Pain is obviously a huge factor in a lot of lupus patients, and it's hard to live a happy life when you're in constant pain. So it's not just about pain medicines though, and there are many ways where we don't need to use medications to help with that. There are certain types of very specialized therapies that can help reduce some of that stress that carries in the body. Often people will find movement like yoga, Tai Chi, Pilates, meditation can be really helpful for helping calming that nervous system down. I'm not one of those doctors that says, you got to eat healthy, 5 portions of fruit and veg, and do like 30 minutes of exercise each day. Of course, we should all do that. Naturally, we don't, and that's okay. But staying inside and not doing anything can be really more harmful than your body. Rest is good, but at some point, that depression can be so overwhelming that you're kind of stuck inside and you're unmotivated to even move. And I would really encourage at least maybe every day, maybe every other day, just go walk around your block. It can be just that simple. Just get some fresh air, just see the sun. Sleep is a huge part, and it's really wonderful seeing a patient do an about turn when their sleep is better. It's easier said than done though. I can tell you that I only average maybe 4 or 5 hours a night, but on a night where I get 8 hours, I feel so much better. Having a support system is really important. Humans are social creatures. We're meant to be with people. It's very easy to hide away, either from fear or from stigma, but reach out. People would love to hear you, many more than you know, many more than you recognize. Self-talk is a huge part of our identity. And when you have a new diagnosis of something like lupus, you can often find yourself talking yourself in a really negative way, a very fearful way. That's where therapy can really help come in. Help hear the other side of the story, flip the other side of the coin. Now, I know for a lot of people who want to access therapy, who want to access mental health support, cannot because of many reasons, like the fact that there are so many therapist offices out there that are not even taking new patients, or your insurance company may not take this one or that one, or your copay, or 101 other different reasons. But I really hope that you know that your team, especially at Charla, is really dedicated to helping find resources that suit you. So Anna decides to join a support group, and she meets others in her shoes. She makes a few new friends, the first that she's made for months and months, and they finally can share their experiences together in a way that few people can understand. Even I, as a medical doctor that specializes in lupus, can't understand my lupus patient's experience. I don't have it myself. I can only try to relate. But with this, Anna feels a little less lonely. She really has found people that really know how she feels, and they give each other tips on how to talk to their friends, how to talk to their family about their condition. One of her new friends decides to share her experience with therapy with Anna. And Anna realizes maybe it's not so scary, and maybe it's something that she can do too. So she starts writing in a journal. She starts documenting a little bit of a diary each day about her thoughts and her feelings. She realizes how negatively she's been talking to herself for so long. So she's curious, and she asks her social workers about what kind of help is out there. So with this, I want to bring it to Giselle, who will talk a bit more about the kind of resources that she and her team can offer. Thank you.
So yeah, I think there's so much. There's so much out there for mental health resources, and yet it feels like there aren't any, because one of the things that I've noticed ever since the pandemic is just so many more people are more open to actually engaging in therapy. Coming from a Latina Hispanic background, it's one of those, we don't talk about our stuff, we don't air out our dirty laundry, sleep it off, toughen up. But I think having that safe space, dedicated space, particularly for mental health treatment therapy, is just something that I am a cheerleader for. And as a licensed clinical social worker myself, I am able to definitely either do temporary short-term therapy in my position, but also I love to refer out, and I like to be able to normalize what that would look like, and establish, somewhat of a plan. So at HSS, we have a few different support programs, specifically for lupus education. So the program is national. You don't have to be a HSS patient. You can be a patient at any institution to receive our care. Many of the programs are hosting monthly support groups, and a lot of them are virtual. Charla's the one, we're coming back on in person because that's what we're hearing from our members. So we're doing some bit of a hybrid. But one of the programs, Lantern, is the Lupus Asian Network, is a free national support and education program for Asian Americans with lupus and their families. It really kind of mirrors also like what we do here at Charla. And the SLE workshop is a monthly education program and support for people with lupus and their friends and families. And that one is hosted throughout the HSS with Roberta Horton, who is our AVP and has basically birthed all of these programs through HSS. And HSS is extremely unique in having this many programs specifically dedicated for lupus, the most of any, I think, institution.
Yeah.
And many of the people that leave HSS have noticed all of the missing supports that, are not there, but then they also have a resource that they can connect back to. So the Lupus Line program is a free national telephone peer counseling service. And that one is, you get matched with a peer counselor and you set up your own schedule, whether you're doing phone calls, whether you're doing video, and again, national, and that's with a peer that has lupus. And Priscilla is the person, she is the assistant director of all lupus programs at HSS, and would do some screenings and kind of match you with like the mentor and like the peer that you would be working with. And of course, Charla. Hello, Charla. This is Charla right here. We are, we're always trying to do as much as possible, really kind of hearing every one of our support programs, and not only all of our education and groups like this, but we have our Girls Night Out event, we do annual picnics, we do the talent show. So anybody that has talent, I'm always calling out for talent in December when we host that. But we always want to bring more and more back. And how can we continue to provide that service? We do annual surveys. After every support group, you got handed an evaluation. You evaluate the speaker. You're able to give feedback and also things that you want to see for the future. And so, yeah, and these are some of the national resources for mental health. 988 is specifically unique. It came about not a bit ago. It's pretty new. And that one took the place of NYC Well, which many may know of. And it's a national free confidential support and crisis hotline. So anyone at any time, you can text 988. The National Alliance of Mental Health, also SAMHSA, which is the National Helpline, is free. Samaritan Suicide Prevention Hotline. At any given point, you can connect to any of these resources. It doesn't have to be that, it's the worst day ever, but you might want just to talk to someone, someone else. It's always nice to speak to someone outside of your immediate circle, because you do get some bit of a, someone with a neutral perspective might teach you a new skill, might help you process what you're thinking and going through. And so a resource that I created, and it's on the actual, let's see if I can share it. Sorry. A resource that I created and is available is this. It's on the table right now. So this is our mental health resource guide that we revamped again. These are some statistics. You are not alone. 1 in 5 US adults experience mental illness. 1 in 20 adults in the United States experience serious mental illness. And 17% of our youth, my goodness, so there's so much out there. These statistics came directly from NAMI, and the resource is just available. It gives you some information, some words to identify what these terms are. So it's really helpful to have. We have some warning signs of what depression and anxiety might look like. And then on this page on the back, you have a few different resources divided by borough. So you can scan the QR code, able to make an appointment, call them up, and a lot of them offer telehealth, which is virtual as well. Many people are like, I want to be in person, which I think is great too, because you lose a lot with body language. You lose a lot just from sitting in the place and just seeing someone in the screen. And then last but not least, again, some of the national resources I put up there, tips from when you're making your first appointment to see a therapist, and then the mind-body connection, some mindfulness apps. I'm very big into mindfulness because I used to do DBT, and it's really great for you. And then right here on the bottom, we have this grounding technique, the 5, 4, 3, 2, 1. That you can do at any given place, any given time to kind of ground yourself. So, it's on the table. We have resources. If you want to take additional, we can give them out as well.